Good day, everyone. In this video, we are going to continue the discussion on the syndromes of two or more organs. Insufficiency of the lung and the kidney. The kidney is where the innate stores. The lung is a fragile organ, so the lung also very soft. You need the in fluid. The relationship between the lung and the kidney. Through the body fluid, the lung also regulates the water metabolism. The kidney dominates the water metabolism. So these two are related through the function of the water metabolism. That's why they can happen together. Insufficiency of lung and kidney, the patient will present as an unproductive cough, very less phlegm, or even blood phlegm. You can see the blood in the phlegm. A hoarse voice, that's because from the insufficiency and from the lung. Soreness and weakness in the waist and knees, that's from the kidney. A dry mouth and throat. Tidal fever. Bone stinging tidal fever. This is the first time that we see a description said that bone stinging tidal fever. What does it mean from bone stinging tidal fever? This is also a direct translation. I also met one patient from one local patient. She described that the heat. She's 43 years old female, and she described the hot feeling. It might be the menopause, but the hot feeling she described that she can feel the heat from the bones. So in this situation, we call the bone stinging tidal fever. This is also a very typical symptom of insufficiency. So tidal fever, night sweat. So from the insufficiency of the lung and kidney, this syndrome sometimes we also cause the metal and water deficiency. That's from the 5 elements. Very importantly, the cough will be unproductive, which means there won't be a lot of phlegm. That's because of insufficiency. We don't have enough body fluids in the body, so even for the phlegm, we don't have a lot. The insufficiency also will result in deficiency heat. The deficiency heat also will concentrate the phlegm, which also will result in less phlegm. And the kidney symptoms. The pulse can be steady. That's also because of insufficiency. It can be rapid because of the deficiency heat. The tongue is red. That's because of the heat. Liver fire affecting the lung. The liver fire affecting the lung, this syndrome, we also call the wood fire affecting the metal. So it is very similar when you melting the metal. You use the wood, the fire from the wood, to melt the metal. The liver fire affecting the lung. The patient will have a burning sensation in the chest and ribs area. The head, distension, dizziness, red face and eyes. Vexation, we also can says more commonly depression or sad, bitter taste, especially in the morning. So these are the liver fire, cough with thick yellow phlegm due to the heat. So wiry, red tongue also with heat. So in this situation, the patient manifests with a lot of liver fire problem, and then the patient presents with cough, with yellow phlegm, and excess heat. So this is the key manifestations of the syndrome of liver fire affecting the lung. Disharmony between the liver and the stomach. This is very similar to the disharmony between the liver and spleen. That's because the stomach is the coupled organ of the spleen. So this is the relationship between the wood and the earth. The patient will present with distending migratory pain in the ribs or stomach area. The patient then will result in poor appetite, depression, frequent sighing. The reason why we don't say here spleen is because of vomiting. And we don't focus on the stool. If we focus on the stool, loose stool, then we will think about the disharmony between the liver and the spleen. So when we talk about the stomach, we more focus on the stomach function or the manifestation from the stomach dysfunction, such as nausea, vomiting. The key manifestations, depression, that's from the liver, from the emotion. And then the patient will present with a lot of stomach manifestations. So this is the disharmony between the liver and the stomach. Liver qi stagnation with the spleen deficiency. As you can see here now, we mentioned the spleen. This is also very similar to the previous one. The liver qi stagnation also will result in the internal heat, as from the wood affecting to the earth. The reason why we need to separate this from the spleen and stomach is because of the spleen manifestations, more with poor appetite, a sensation of incomplete bowel evacuation, bowel sounds, so you can hear a lot of noises from the stomach, from the abdomen. Loose stool is the spleen deficiency. In the meantime, the patient will present with liver qi stagnation, which results in a pain in the ribs area. Depression, frequent sighing, restlessness, worry, the pulse. So these are the manifestations of the liver qi stagnation and spleen deficiency. The reason why the abdominal pain will alleviate after bowel movements is because bowel movements can relieve the qi, especially from the qi stagnation. So this syndrome will have the spleen problem, loose stool, the patient will feel depression. That's from the emotion. This is the liver and the spleen. The indeficiency of the liver and kidney. This is the relationship between the wood and the water mostly reflects in the indeficiency. Deficiency heat will result in the kidney problem, the liver problem, and the indeficiency. So the liver problem is dizziness, blurred vision, tinnitus, poor memory, insomnia, dream disturbed sleep. This is also already affects the heart. So as you can see here, the indeficiency, when we got indeficiency in the kidney, and then we got the indeficiency in the liver, do you think that we will have sufficient in the heart? So the answer is no. That's why the patient also will present with manifestations of the heart. That's also the deficiency. The deficiency heat will affect the heart as well. So the patient mostly presents with the discomfort in reflect the kidney, the liver, and the deficiency heat. On the liver, we're going to focus on dizziness, vertigo, blurred vision, tinnitus. So these are the liver's problem. Yang deficiency of the spleen and stomach and spleen and the kidney. This is one of the most important and common syndrome in our daily practice. The spleen is where the food, the acquired qi comes from. The kidney is especially the kidney yang is the minister fire. The kidney at the bottom of the spleen is similar to the fire. So you put the food in a pot in the spleen, and then you need the fire, the heat to cook the food. That's in a normal process. Now we got the kidney deficiency. We don't have the heat, or we don't have enough heat at the bottom. So the food from the spleen, the spleen receives, sometimes will be uncooked. So that's why this manifestation can present with stool containing undigested food, uncooked food from yang deficiency, spleen yang, and kidney yang deficiency. The patient also may present with chronic diarrhea. That's also due to the yang deficiency. This chronic diarrhea also very more likely to happen before dawn. So that's the kidney yang deficiency and spleen yang deficiency. Always loose stool, yang deficiency, you have the cold condition, the cold pain. So that's the spleen and stomach plus deficiency cold syndrome. From our textbook, we have introduced some of the common manifestations of mostly two organs from these two videos. In clinics, we're going to analyze from the different symptoms to conclude to the syndromes. So if a patient presents with the manifestation more than the manifestation that we have introduced in the textbooks, that's also possible. From these a few syndromes, we only give you some examples or some more common syndromes in clinics. We don't match the patient with our textbook. We're going to study from our textbooks. We're going to study the way of thinking. We're going to study the way of analyzing. And then from clinics, we're going to use the 4 diagnostic methods to gather the clinical information, and then we're going to use the way of thinking, the way of analyzing to analyze the clinical manifestation of individuals, and then the syndromes will base on the analysis will base on the manifestations of individuals. So when you see a patient, don't open your textbook and compare with the patient to your textbook. We don't find the syndromes from the textbook, although in the textbook, such as for the kidney disorder, the kidney syndromes, we introduce a few, but sometimes if you see the kidney with the palpitation or the kidney syndrome with loose stool and the palpitation happens together, then that's the kidney, spleen, and heart problem, which we didn't introduce in the textbook. That's also possible. So in the clinical practice, we more based on the patient themselves. Until today, we have introduced all the contents of the Zang differentiation. This is one of the most important differentiation methods, and from Zang differentiation method, we can identify where the diseases we can locate to the actual organs, which can help us from the treatments. Because from the treatments, we're also going to focus on the organs. Thank you for your attention.